We gather here today to launch the first single-payer healthcare system in America, where healthcare follows the individual, isn't required by an employer. That's a huge jobs creator, where we all win and we all pay. Most importantly, a healthcare system that is sustainable, that spends our healthcare dollars making Vermonters healthy, not on insurance company profits and not on waste and inefficiency. We will get this done in Vermont. Yeah. First, we're going to hear from a few of the folks that helped make this moment possible. Dr. Deb Richter, who came to Vermont as a doctor from New York, knowing that after watching patients suffer, after watching patients lose their life because of a lack of coverage, she decided out of the 50 states to go to Vermont and make people healthy, and in her spare time work for a single-payer healthcare system that was going to allow her to practice medicine again and make sure that no one lost their life from a lack of coverage. Without Deb's commitment, we wouldn't be here today.
And to all the legislators who voted for this bill, we thank them profusely for doing that, because it was bold and they stuck their necks out, and we have to stand behind them and endorse their candidacy. But all along, people have said that it was impossible to get this far. But here we are. And now the real work begins. We have a long road ahead of us to get this bill in place. Let's get started, but after the party.
Vermont, once again, is leading the nation in its tradition of independent thinking. Truly, this law we're signing today is more than a healthcare law. It is economic development for the state of Vermont. With an equal playing field, Vermont businesses can play on the global marketplace. The law about to be signed is a culmination of many people's efforts. It's an example of how governmental bodies, nonprofit organizations, and leading the pack, businesses can work together to affect positive outcomes.
As many have said, this bill is a first step in a multi-year process, but one of the most important things we're doing here today is laying out a clear vision for where we want to be. And this vision for Green Mountain Care is something that I think most Vermonters are very excited about. And I think Vermonters are really hungry for common sense solutions, for reasonable discussions, and straightforward answers to their health reform questions. And that's exactly what this bill does. And VPIRG is not only committed to the success of Green Mountain Care, the state's universal and publicly financed healthcare system, but we're committed to keeping Vermonters informed and engaged throughout the process. If we stay focused, keep our eyes on the prize, I'm confident that Vermonters will have this system. We will all have access to high quality, universal, affordable health care that we can count on, and that our little state can help turn the tide for the rest of the country.
It's amazing that we're here and that we could be debating the fact that there could be something wrong passing a law that creates coverage, healthcare coverage, for all Vermonters. It should be at the very core of what we believe in as citizens. It should be not debatable. This is the beginning. This is not the end. We have hard work to do. There are definitely people who want to see this fail. We cannot let that happen. We need to work together to show the way for the entire country. We can do it. Vermont's done it in the past. We'll do it again. Thank you very much.
And never in my wildest dreams would I ever have thought that I would be involved in two of the greatest social movements of my life, and I think the lives of most people here. The first came when we took courageous stands to say to our brothers and sisters who are gay and lesbians that they are allowed to marry those who they love and care for. Yes. At that time, I thought that was the proudest moment of my professional career here in the State House. But I can tell you, today marks a second part of that. And now, to understand, to be here, and to say to you folks that health care is a right that every American, every Vermonter should and shall have. That is important, and that is spectacular. The next few years are going to be very difficult. As the speaker mentioned, there are many people out there that would love to see us fail. We have to look at them and figure out why. Many of them may have insurance companies or whatever. They're afraid that they're going to lose some business. And we all have to be ready to fight the fight that surely will be coming over the next 2 or 3 years. So I ask you today to make sure you're with us back in next January when we start the second part of this fight. And we will win. We'll win because it's right. Thank you.
Our state will be better off for it. We will be healthier. We will be happier. We will be more secure. And I think we have a lot of work left to go, but thank you for giving us the chance to make things better in Vermont.
We've talked a lot about the economic benefit, especially for the majority of businesses in Vermont. They pay a huge and unpredictable portion of their profits to provide health care for their employees, those that can, and most of those who do not wish they could. This is going to give them more money to invest in their companies, more money to invest in their employees, money to invest and grow. Putting this in place, making the playing field level for Vermont, and really putting us in a better fiscal advantage, our businesses at an advantage over businesses in other states.
I also want to thank President Barack Obama for his willingness to move the federal date of preclusion from single payer from 2017 to 2014. The President gets it. I also want to thank him for his courage in health care, allowing the federal bill to be a bridge to this system. And this is what the President and Bernie and Pat and Peter understand. The states must and should be the laboratories for change and for reform. And I give this back to Deb Richter. She's been fighting.